Good afternoon. My name is Lorraine York-Edberg. I'm the SHINE Director in the Franklin, Hampshire, and parts of Hampden and Worcester County. And I run the SHINE program serving health information needs of everyone with Medicare. And what we do is we assist people in the community at senior centers and different locations to help them figure out what their Medicare needs are. And I just would like to go over some information. You have a few things with you. You've got a SHINE brochure. You should have gotten one of those. And information about the yearly plan review, which is really information about what is going on right now with the Medicare open enrollment period that started on October 15th and ends December 7th. A very helpful number card that has phone numbers for the Social Security Administration, also Medicare, and the State Prescription Assistance Program, the State Mass Health or Medicaid office, and the Pharmacy Outreach Program. And I also have included in your packet an article that I recently wrote about the Medicare open enrollment and some information about some helpful programs and benefits that will help people, and they're all regarding their income and their assets. So I'd like to begin my presentation by just telling you a little bit about SHINE. So the SHINE program is actually a federal program. It's the SHIP program with a P, SHIP in every state. It's the state health insurance program. And in Massachusetts, we call it the SHINE program because SHIP was already taken. That name is the state head injury program. So with the SHINE program, we have 600 volunteers statewide. And we offer unbiased, confidential assistance with health insurance counseling and information. Really what I consider SHINE counselors are educators. SHINE counselors have to go through a 13-day training. They have to take an exam. They go to monthly meetings, and they also have to take an exam every year. They have to be recertified, and there's the monthly meetings. There's always in-services about all sorts of new things that are happening, as you can well imagine with our healthcare system, how things change very quickly. So what we do is we really educate Medicare beneficiaries. We talk to them about insurance options. We can help them with mass health applications, and we help resolve problems. And one of the biggest things that we do is screen for public benefits. And we want to make sure that if there's any benefits out there that the person may be eligible for, that they're receiving that benefit. For one reason, because they could get an additional income from one of the programs called the Medicare Savings Program, and that's very helpful. And I'll go over that later in the program. So just so you better understand Medicare, there's 4 parts to Medicare. There's Medicare A, Medicare B, Medicare Part C, and Medicare Part D. Medicare A is the insurance for the hospital. It does have gaps in it. Medicare was never meant to be the complete insurance for everybody, and it was always meant to be helpful. But many people get more than just Medicare. They add insurance onto their Medicare so they have better coverage. So Medicare A covers your hospital insurance and your nursing home coverage. It has a deductible for the hospital and a copayment after 20 days for the nursing home. Medicare Part B is your outpatient services, things like emergency room, ambulance, durable medical equipment, every time you go to the doctors, laboratories, when you seek any providers or specialists. Those are all outpatient services and are billed under Medicare Part B. Now, Medicare A doesn't cost anything. It's free as long as you've worked 40 quarters in the Social Security system. And Medicare Part B costs $104.90, and that's monthly. And if you are receiving Social Security, it's taken out of your Social Security. Now, for those of you who have higher incomes than $85,000 as an individual or $170,000 as a couple, your Medicare Part B premiums would be adjusted and you'd pay a higher amount of money for them. Now, one thing that's happened this coming year is that there was no Social Security increase, no COLA for Social Security in the year 2016. So usually the Medicare Part B premium makes changes, goes up a little bit, and this year, because there was no Social Security increase, there's not going to be an increase for all of those people that are currently receiving Social Security and are on Medicare Part B. For any new people that are going to be turning 65 in 2016, then their Medicare Part B premium will be $121.80. Normally that figure would have been much higher this year, but through an act of Congress, instead of having that Part B premium doubled, they lowered it, and they're going to do it in increments, and people will pay a little more over the next 3 years for that. Another piece that the Congress did affect this year was the Medicare Part B deductible. So under Medicare Part B, the outpatient services, the amount of premium is based on usage in all of the United States and all Medicare beneficiaries. Normally, the Medicare beneficiary pays about 25% of the costs, and Medicare Part B services pay 75%. And that premium for us is $104.90. Now, if a person has higher incomes, then they will pay more. So Medicare Part C is Medicare Advantage plans. These are plans and programs like HMOs and PPOs, so those are health maintenance programs, health maintenance organizations, and preferred provider organizations. Are you familiar with preferred provider organizations? It basically means that you can go in and out of network. And with a HMO, you have to stay in network. With a PPO, you're allowed to go outside of the network. Sometimes the co-pays are higher if you go out of the network, and the premiums can be higher as well. So, people have to decide what they would like. If you go with a Medicare Advantage plan, known as the HMOs, PPOs, or Part C, that's where all the confusion comes, right? There's a lot of different names for exactly the same things. So under Medicare Part C, you can have your drug benefit and your health insurance combined with that. So that can be very helpful. It means you only pay one thing. But if, in order to purchase a Medicare Part C plan, you still have to have Medicare A and B. Now A is free, but the B is going to cost you $104.90 if you're already collecting Social Security, and a little more if you're turning 65 in 2016. Now, we talk now about Medicare Part D. As you can imagine, that is the Medicare prescription drug program. And that started in 2006. And in 2006, when it started, it created a very reactive view of Medicare, that it was very negative. And now people look at Medicare prescription drug benefit, and it's a really great thing because people actually have a drug benefit through Medicare, and that never happened before. The problem is if somebody does not take any medications, they may not want to get a Medicare Part D drug plan. But what I say to people is, well, there are a couple plans that are, one plan's under $20 a month, and one plan's just a little over 20. So you could protect yourself by getting a Medicare prescription drug plan and having it in case you need it. Now, if you don't pick up a Part D drug plan when you become eligible for Medicare, unless you have coverage through an employer or your spouse, that is at least as good as the Medicare prescription drug benefit, then there is a penalty of 1% for every month that passes. And that 1% right now is about 34 cents a month. So it's not a lot in the first year, but you have to remember, if you let go and not pick up a Part D plan for a couple years, that would be 24 months times 34. And that penalty is with you for a lifetime. So it's important that people are informed about the Medicare prescription drug program. And it can be very helpful because it really does offer a lot of benefits towards your medications. So another thing I wanted to talk to you about was Medicare enrollment before we talk about the prescription drug open enrollment period. So if a person is 65, that is when they're eligible to pick up their Medicare. Their initial eligibility starts 3 months before their 65th birthday, the month of their 65th birthday, and the 3 months after. So that's the period of time that they can pick it up. And if they do not have a coverage through an employer or their spouse's employee, they should really pick it up at that time, because there's also a penalty for the Medicare Part B. Now, Part A is free, so if a person was working and they had coverage through their insurance, they could delay their Part B premium. So that would not be a problem, and they could pick it up when they retire. As long as they're actively working and covered under employee group coverage, then they would not need to pick up their Part B at that time. They could just get their Part A for free and pick up their Part B later. So you can do the initial enrollment for Medicare A and B right on the computer at the socialsecurity.gov website. And it's very helpful to do that. If you're delaying your Medicare because you're working or your spouse is working and you're covered through their health insurance, through their work, then you can delay that, but you will have to contact Social Security to start the Part B, to get the Part B initially started. So the other piece is that there are also Medicare for people that are under 65. So if you were disabled and you were under 65, say you worked for 30 years and something happened where you had an injury and you were no longer able to work and you applied for Social Security disability and you were receiving your Social Security through that disability, then you would become eligible for Medicare on the 25th month of the anniversary of that disability. So at that point, people that are under 65 with a disability could actually get Medicare as well. So now I'm going to move on to what we're here to talk about today in more detail, which is what is the Medicare open enrollment? Well, this is the one time of a year where a person can make changes to the insurance coverage that they have. So if a person has a Medicare Advantage plan, one of those Part C plans, then they can change that plan to a standalone prescription drug plan, which there are 26 plans in the state of Massachusetts for 2016. And if you make a change from a Medicare Advantage plan to a prescription drug plan, it would disenroll you from your Medicare Advantage plan and you'd go back to original Medicare. So people have to make a decision about what they want for insurance. And what we do is really inform and explain to people, what their options are. And mostly people are more concerned about making sure that they're saving money, that their drugs are covered, that there's not a lot of restrictions. I mean, there are important details that you want to pay attention to with these Medicare prescription drug plans. And one of them is restrictions like prior authorization. Now, prior authorization means that the doctor has to write some sort of a note saying to the company that you need this medication. So it actually stops people from getting the medication easily. So when we assist people with choosing one of these drug plans, we always try to find 2 or 3 choices with the least restrictions. And we can assist people in enrolling into one of these Medicare prescription drug plans, either the standalone plans or the Medicare Advantage plans. And it's really quite simple. If you're interested, you could go to the Medicare.gov website and follow the information there about the Medicare prescription drug plans. So the open enrollment dates start on October 15th. That's when the open enrollment begins, and it ends on December 7th, and the enrollment begins on January 1st. So if you enroll between October 15th and December 7th, then the enrollment would start on January 1st, and their new health or drug coverage would begin at that time. So it's important to review your health and drug coverage at this time, because the plans have the opportunity to make changes. They may change their premiums, They may change the coverage of certain medications. So people need to make sure that their medications that they take are still covered by that plan. And they want to make sure that their costs are not too inflated. We've seen a couple plans go up, $15, $20 for the 2016 year. And a lot of those people are coming to us saying, wow, I can't believe it went up this much. Is there a better plan? Is there something more reasonable? And really, we found this year that there are a lot of changes in the premiums for the drug plans and the Medicare Advantage plans like Health New England and Blue Cross, Blue Shield. These plans have gone up a little bit, and people may really want to re-look at what they have and make sure that it meets their needs. I mean, when you're looking at insurance, you're really basing your need for insurance on what your health issues are. If you have a chronic issue, you may need more health insurance. If you go to the doctors a lot, you're in and out of the hospital, and you're having surgery, then you might want to pick a certain kind of plan that you have less out-of-pocket costs with that coverage. So it's helpful for a person that's meeting with a Shine counselor to tell them that. And the Shine counselors always ask things about, how was your last year of health, and, do you have any chronic illnesses that you might be hospitalized or need more services throughout the year. So we help by reviewing the plan costs and benefits and comparing them. And there are a lot of reports that we can get from the Medicare.gov website, so we can show them to you, and hopefully then you'll be able to make a decision about what the best plan is for you. And you can do this yourself by going to the Medicare.gov website. So, it's very important to do during open enrollment is review your Medicare supplemental and drug coverage options to see which would be the best for the year coming up, and just to compare the plan prices and costs. And you could decide to stay in the plan that you're in. That's always an option. Probably, 1 out of every 5 people are staying in what they have currently because there's such little difference out there. One thing that we found this year is that, over the past few years, is that there's something called preferred pharmacies. So the drug plans actually have contracts with certain pharmacies. And if you have a preferred pharmacy network and utilize the preferred pharmacy network rather than a standard pharmacy, which really just means they have a contract with them, then you may pay much lower costs for your medications, especially your generic drugs. So that can be very helpful. So it's good to look at a couple pharmacies when you're reviewing, what plan you might be interested in. And you always want to make sure that you're enrolling by December 7th for that January 1st start date. Now, there are some additional programs out there that are very helpful. Mass Health, Extra Help, and the Medicare Savings programs. These are programs that can be very helpful in assisting people with the out-of-pocket costs, premiums, and copays of their drug plans. Now, if a person is on any of those programs, then they're automatically eligible to have reduced premiums, reduced copays, and reduced out-of-pocket costs and deductibles towards their Medicare prescription drugs. And I have given you the information on the yellow sheet, on the back of the yellow sheet, where it says concerned about Medicare costs. There may be help out there. So for example, if a person's income was less than $1,345 as an individual and their assets were less than $7,280, then they would be eligible to have their Medicare Part B premium paid for by the state and federal government. That would give them an extra $104.90 additional into their Social Security check that they would be normally paying for their Social Security Medicare Part B. So if a person's eligible for that program, they're also eligible to get their Part D drug benefit at absolutely zero cost. So that can be very helpful. For a couple, that same program, the income limit is $1,813 and the asset limit is $10,930. And that's really just to give you an idea, but there are a lot of programs that can be very helpful. The state's Mass Health program this year is $1,001 income eligible. That's a person that has income less than $1,001 and assets less than $2,000. If a person meets that criteria, then they're eligible for the state's Mass Health, or on the federal level, we call it the Medicaid program. And that program also gives them that dual eligibility into getting assistance with their Medicare Part B premium and extra help with their medications, premiums, and copays for drugs. So that can be a really big deal for somebody that meets that criteria. And for a couple, that is at $1,348 with an asset limit of $3,000. So those are some of the programs that are out there. If a person has one of these programs, then they can make a change at any time towards their Medicare Part D plan if they're interested. Now, what do people do to supplement Medicare? And I know that there's a couple people here that are going to be turning 65, and this can be helpful information. So when you're turning 65, really you need to be educated about what the gaps are in Medicare. Medicare Part A doesn't cover the first $1,260 at the hospital. And it also doesn't cover day 21 to day 100 at a nursing facility. And Part B does not cover the Medicare Part B annual deductible of $147 going up to $167 in 2016. So if a person wanted to get those gaps filled, they may pick up a Medigap policy. Medigap policies fill the gaps of Medicare. First Medicare pays, and then the Medigap picks up the cost of that. The Supplement 1 plans, they cost around $200 a month, and they allow you to go to any doctor, any hospital, anywhere. Now that can be very pricey. Some people may think, well, I don't go to the doctors very often. I'm hardly ever go to the hospital, and I'm not going to be in a nursing home. So they think, well, that's too much. So they might be interested in a Medicare Advantage plan, like a Medicare HMO or a PPO. You would pay less for these kinds of plans, and they use networks of doctors and hospitals, and you pay less if you stay in the network. And with a PPO, you can go out of the network, but usually you pay a little more. These have premiums, and the premiums range anywhere from $0 to over $200 for these Medicare Advantage plans. And there's many companies that sell them in our service area. Here we have Health New England, Blue Cross Blue Shield, and we have Tufts, and we have Medicare Complete through AARP. And those are really the plans that we have in this service area. So if you were to go with one of those Medicare Advantage plans, you could get the drug benefit included with your health insurance. So you'd have the drug coverage and the health insurance combined. You'd be paying your $104.90 towards your Medicare Part B premium out of your Social Security, and then you'd pay a bill for your insurance beyond Medicare. For your drug coverage and your health insurance. If you went the other route with a Medigap policy, then you'd have to choose a standalone drug coverage, one of the standalone drug plans for your drug coverage. Other people utilize the veteran services with their Medicare. So they may go to a VA clinic. There are VA clinics in many different places. There's one in Greenfield. Closest to here is the one in Leeds. People may use the clinics and the hospitals for some services, but if they have Medicare A and B, they still can use a regular doctor and regular hospitals. A lot of veterans, even though they get their medications through the VA, still may have some traditional insurance. But if you're a veteran, it's always a good idea to see, what you might be eligible for through the VA. And some beneficiaries that we work with have retiree plans. Now, if you worked for the post office or if you worked for UMass, you may have a state retiree insurance, GIC, the Group Insurance Commission, or the Federal Employer Health Benefits Program through the feds. or maybe a private retiree insurance. There's not as many retiree insurances as there used to be, but that's another way that a person will get their medical needs met, is through retiree plans. So a person has those choices, and I'm going to actually give this to the person doing the recording, and it's just a chart that shows you how you can supplement coverage and options, and I think it's a very helpful chart for you to look at. Okay. So one thing I didn't tell you about the Medigap policies is that those Medigap policies are the policies that supplement Medicare, and you can go to any doctor, any hospital, anywhere. So if you're a snowbird and you go to Florida for 6 months and you're here for 6 months, then a Medicare Advantage plan may not be the best plan for you, because you're only going to be covered for emergency care outside of your own area. So if you go to Florida and you have a Medicare Advantage plan and something happens, it will be covered. But if you're there for 6 months and you want them to look at your feed, or you're having something going on that isn't an emergency, then your coverage will not be going on. You won't have any coverage wherever you are unless it's an emergency. With a Medigap policy, you can go to any doctor, any hospital, anywhere. So you can get second opinions. It's a little easier to do that with a Medigap policy, and you have the ability to even go out of the country with these Medigap policies. So if you're a person that travels a lot, a Medigap policy may be a better idea for you. Okay? The Medicare Advantage plans, on the other hand, they offer additional things like help with glasses, maybe a little help with dental. So the baby boomers, people that are just turning 65, may be more interested in a Medicare Advantage plan where they're not paying quite as much. And you know that every year you can make a change, so you can assess your health insurance needs on an annual basis. So every fall you'll be looking at, well, I have a hip surgery coming up. I might want to change my plan from a Medicare Advantage plan to a Medigap policy, because I'm not going to pay all those out-of-pocket costs for physical therapy or surgeries and so whatnot. So it is really insurance that is based on what your needs are. And when we work with a couple, their needs could be totally different. One person may go with a Medigap policy and the other with a Medicare Advantage plan. It really is based on need. Okay, so in order to get a Medicare prescription drug benefit, a person has to have at least Medicare A. They can have A and B, but they have to at least have Medicare A or B. And the coverage provides prescription drug plans, also known as standalone plans, or you can also get them through Medicare Advantage plans. So there's 2 ways to get your drug benefits. One is through standalone plans, and the other is through the Medicare Advantage plans that also have the health insurance programs. There's one program that I did not talk about yet, and that's called Prescription Advantage. That is a state prescription assistance program. And that program assists people with the out-of-pocket costs during an area where the Part D drug benefit is limited. We used to call it the donut hole, right? And now we call it the coverage gap, because the Affordable Care Act has shrunk that hole. And by 2020, all Medicare beneficiaries will only pay 25% of their drug costs in that coverage gap. But at this time, they're paying a little more than that. And every year it goes down for the cost of their brand name drugs and their generic drugs in that coverage gap. So Prescription Advantage helps pay the copays, and there's no asset limit. There is an income limit for Prescription Advantage, but it's very high. And I think really that's it. The rest of this information is regarding another topic. Do I have any questions? Well, make your decisions and decide what you would like to have for your insurance for 2016, and seek assistance if you need it. Thank you very much.